Hello guys, welcome back to my YouTube channel Dr. R.kmedicos. In this video, we are going to discussing about cell injury and cell death. So continue to watch my video at last and never skip this video. And if you are new at my YouTube channel, then please subscribe, like and share my YouTube channel and never forget to press the bell icon so that you will get notification of all video uploaded by me on my YouTube channel. Let's start this video without escaping the time. Before discussing about the cell injury and cell death, we should need to know about the etiology and pathogenesis. What do you understand by the etiology? And so, the etiology refers to the underlying cause and modifying factor that are responsible for the initiation and progression of disease. And while the pathogenesis refer to the mechanism of development and progression of disease. So, in this way, we can say that etiology refers to why a disease arises, while the pathogenesis describe how a disease develops. Now, we will discuss about the cell injury. What do you understand by the cell injury? And when, if the adaptive capability is exceed, or if the external stress is inherently harmful or excessive, then cell injury develop. And now we will focus on the type of cell injury. There are mainly two type of cell injury. First is the reversible type of cell injury and irreversible. And now we will discuss about the cell death in brief. And first statement you should remember is that the cell death is one of the most crucial event in the evolution of disease in any tissue or organs, as you already know, and it results from diverse causes including ischemia, that is a lack of blood flow, infection, toxin and immune reaction. We will discuss one by one in coming section. And the advantage of cell death is that the cell death is also a normal and essential process in embryogenesis and the development of organ and the maintenance of tissue homeostasis. Now we will discuss about the cause of cell injury in detail one by one. And first factor, and that is responsible for the cell injury, is hypoxia and ischemia. And first statement you should remember is that the hypoxia and ischemia are among the most common cause of cell injury, and the most common cause of hypoxia is ischemia resulting from the arterial obstruction. And the second factor that is responsible for the cell injury is the toxin. As you already know that the many drugs in the therapeutic doses can cause the cell or tissue injury in the susceptible patient or in many individuals if used excessively or inappropriately. And the third factor which is responsible for the cell injury is the infectious agent. As you already know that all the type of disease causing pathogens including virus, bacteria, fungi and protozoans are also responsible for the cell injury. And the fourth factor is immunological reaction. Immune response elect inflammatory reaction, as you already know, which are often the cause of damage to the cell and tissue. And the fifth factor is the genetic abnormality. Genetic defect may cause the cell injury, as you already know. And the sixth factor which is responsible for the cell injury is the nutritional imbalance. Protein calories insufficiency among the population remain a major cause of cell injury. And the seventh factor is the physical agent. The physical agent like the trauma, extreme of temperature, radiation, electric shock, and the sudden change in atmospheric pressure all have the wide ranging effect on the cell and which causes the cell injury. Now we are going to discussing about the sequence and events in the cell injury and cell death. Firstly, we will discuss about the reversible cell injury. And what do you understand by this term, the reversible cell injury? The reversible injury in the stage of cell injury at which the change function and the morphology of injured cell can return to normal if the damaging stimuli is removed. And now, the characteristic of reversible cell injury. And first characteristic is that in the reversible cell injury and the intracellular organelles typically become swollen, and this can be explained by this statement is that this is because they take in water as a result of the failure of energy dependent ions. pump in the plasma membrane, leading to the inability to maintain the ionic and fluid homeostasis, and which, as a result of that, the cell and intracellular organelles become swollen. In some form of injury, the degenerated organelles and lipid may accumulate inside the injured cell, and the barbiturates, which are commonly used as sedatives in the past and are still used as a treatment of some form of epilepsy, are metabolized in the liver by the cytochrome P450 mixed function oxidase systems, and that is found in the smooth endoplasmic reticulum. And the third statement is extra, and is not the characteristic of reversible cell injury, but this statement is very important for NEET PC examination. Now we are going to discussing about the characteristic of irreversible cell injury, and first characteristic is that the cell become unable to restore the mitochondrial function, and that is function like the oxidative phosphorylation and adenosine triphosphate, that is ATP generation, even after the resolution of original injury. And the second characteristic is that the loss of structure and function of the plasma membrane and intercellular membrane, and loss of DNA and the chromatin structure and its integrity. Now we are going to discussing about the cell death in brief. We will discuss about the cell death in detail in next video, and in this video we will discuss firstly about what is the cell death, and when the cell are injured they die by the different mechanism depending on the nature and the severity of insult. And now the accidental cell death, what do you understand by this statement or the word that is accidental cell death? And this means the severe disturbance such as loss of oxygen and nutrient supply and the action of toxin cause the rapid and uncontrolled form of death, and that has been called the accidental cell death. And the morphological manifestation of the accidental cell death is the necrosis, and necrosis is the major pathway of cell death. And I hope that this video will be knowledgeable and informative for you, and we will discuss the remaining part of the cell death and cell injury in next lecture. Thank you for watching my video at last.